Okay, for the test, you need to know these canine and feline diseases, and the test is going to be more of a perspective of what are clinical signs of the disease. I just hit record. Thank you, though. What are the clinical signs? Is it a core vaccine? And, you know, or is it a recommended vaccine versus part of the core group? And if it's recommended, also, what did we stress? What type of animals, you know, what is in their environment or their behavior that means they need to get a vaccine? For example, kennel cough. I mean, unless you're really going to board your animal or you know, sometimes be in a kennel, like you're traveling, or you go to doggy parks or doggy daycares, Bordetella is not necessarily always given to every animal. But a lot of times if you're going to board them, you need to get a Bordetella. I think of something like Lyme is not on here. But when we talked about Lyme's disease, it was like, do you go camping? Does your dog, you know, do you live by the woods and they go in like tall grasses? So there was kind of environmental behavior factors on some of these vaccines. You know, feline leukemia for cats, it's not a core vaccine, but if you have an outdoor cat, especially an unneutered male, they're going to have a higher likelihood of spread. So they might recommend it. So is there a reason a non-core vaccine would be recommended? And what are, and when I ask for clinical signs, I don't necessarily want to see, well, I mean, anorexia. The problem is so many diseases cause anorexia where they're not eating. There are some core clinical signs, like parvo is like raging diarrhea. Feline, you know, rhinotracheitis and calicivirus, you know, sneezing, ocular nasal discharge. There's some key clinical signs, and that's what I would want to see. I don't, you know, if you put anorexia for every disease, it's like, but there's a lot of other diseases that cause anorexia. So what are some key kind of red flag clinical signs of these diseases? And what are risk factors, and then also how they are spread. So if we open, now I'm going to try to open the PowerPoint. Hopefully it will not. Actually, let me print this real quick. Okay, let's see, because earlier my PowerPoint was, that's what was making my computer crash, but I want to try to pull up the canine diseases. See if it wants to cooperate. And nope, we're not going to talk about swine anesthesia. Let's see if it opens up. There's the right PowerPoint. Okay. Okay, so this was the PowerPoint that was on your Moodle page, which the DHP, distemper hepatitis, parainfluenza, is in the core group. And then, I'm sorry, distemper, hepatitis, parvo, rabies. Parainfluenza was part of the non-core, the Bordetella. And of these, we talked about distemper, which again, key kind of red flag is, well, it's aerosolized. So coughing and sneezing and obviously fomites. Anytime something's aerosolized, fomites spread it, but what's on it? It's not feces. It's going to be like either saliva or respiratory droplets are going to be on the fomite. But the key, and you know, fever is another clinical sign that went with a lot of things, but the main thing I think of with distemper is CNS, ataxia, hypersalivation, can progress to seizures, and then they can get the hyperkeratosis, which hyperkeratosis, keratin, it's kind of like the keratin goes crazy, overgrowths on the nasal planum and the paw pads. And basically, how you diagnose a lot of these diseases, clinical signs, especially if it's a puppy. Distemper is going to be rare in an adult, but if it's a puppy, and especially if they know of litter mates affected, but a leukopenia, you can do serology. Now, anytime you see serology, that's blood testing. You're testing serum. And then obviously, if we submit for necropsy. And when I ask on the test, what are examples of supportive care? Now, different diseases are going to require different supportive care, but basically, you know, intravenous fluids, potentially sub-Q fluids, although if they're very ill, they need to be on intravenous fluids. Nutritional support, especially if they're anorexic, you may need to alter their feedings, potentially do tube feedings. And then if they're, remember, anticonvulsants treat seizures. So if they're seizing, they may have to have anticonvulsant therapy. And then what's an antipyretic? What do antipyretics do? What do they treat? Anybody? If you're pyrexic, what does that mean? I should play the Jeopardy music. Ding, 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 fever. Thank you, fever. So if an animal is pyrexic, they're febrile. That's another way to say they have a fever. So an antipyretic would be, you know, potentially Rimadyl. You know, now when we have a fever, Advil's an antipyretic. Tylenol is an antipyretic because they're anti-inflammatory medications usually bring down fever. Now, a lot of times, fever helps fight the illness. You're not necessarily, you know, sometimes, you know, fever can be a good thing because it means the body is fighting the illness, but it can also make them feel very ill. So it's kind of like a double-edged sword. You want to minimize the fever, but also you do want the properties of the reason there is a fever. So antipyretics. And then always what I want you to know when I'm talking about treatment of a lot of these illnesses, why are we giving them antibiotics? Secondary infections, exactly. So you are supporting so they're very susceptible to other infections. You know, the bacteria, a normal immune system, every people, dogs, horses, whatever, everybody has what's called commensal bacteria, which is good bacteria. It means it's hanging out. But bacteria are also kind of waiting for their chance to take over. Hence, if the immune system is taxed, it's their chance to proliferate and potentially cause these other infections. So most treatment plans are going to, you know, include some form of antibiotics. And the other thing that I want you to think about, depending about what virus I'm asking you about, can every animal with all of these viruses get oral antibiotics? Should they all be on oral antibiotics? Why not? It's easier. Exactly, Catherine. So, you know, if you're treating a parvo animal, they're vomiting and having diarrhea. And so the problem is if you go the oral route, and sometimes it can make them feel more sick, or they're just going to vomit it up. So we really need to use intravenous medications. If you have vomiting and diarrhea, the per os route or by mouth a lot of times is not going to be effective. So we need to do intravenous. Now, again, that's going to depend on the illness. If it's an upper respiratory cat, and even if they're not eating great, you can usually still give them oral antibiotics. Some antibiotics do cause nausea, and I always tell clients to try and give it with food. But if they're not eating, you can try to do it on an empty stomach. And if they become ill, we can change the plan. But sometimes they will tolerate. But again, it depends on what virus we're talking about. But I do want you to know what is meant by supportive care. Be able to give me examples of which instances. Hepatitis affects what organ primarily? If you hear HEPA, it is the liver. So this virus affects the liver. The way I think of, the liver, and maybe I said this to you guys in anatomy, I think of it kind of like the body's Brita filter, or you can think of it like a HEPA filter for a house. Because remember, all GI blood flow goes to the liver for processing. Think about filtering. Takes out useful substances, excretes wastes, processes nutrients. So everything's got to pass through this big organ like the liver, like a HEPA filter. HEPA. Anyway, so hepatitis causes inflammation of the liver, and it's adenovirus. But again, clinical signs, and again, it can be spread. It can be resistant. Remember, too, something that I want to talk about that I didn't ask a question on the study guide because I just want you to talk about the diseases. But when you have a virus, it is either enveloped or non-enveloped, which means, think of it like an envelope. When a virus is enveloped, it means it has a coating. And those are actually the viruses that are easy to kill. Because think about the virus is relying on the envelope and it is not hardy itself. When a virus is non-enveloped or does not have that shell, that protection, the virus has to be more hardy because it doesn't have anything to rely on. It's kind of like, I feel like people in Alaska, they could probably go out in a flannel and they are just totally fine. And you and I would maybe freeze to death because I'm not used to, I've not made myself hardy because it's not my normal environment. Well, like I said, an enveloped virus has become reliant on that coat or that covering, and a non-enveloped virus has to be hardy to live. So it is, because this is non-enveloped, it is pretty hardy. This isn't a super common one, but it can be spread saliva and feces, also the urine. So urine, feces, saliva. And some of the clinical signs, now again, fever, the anorexia with this disease comes from the fact that when they have inflammation of the liver, it can just make them feel kind of nauseous, sometimes causes elevation in liver enzymes. But one key here is this petechia. Anytime something affects the liver, it can affect the clotting factors. And if the clotting factors cannot function, the animal is prone to bruising, and that's petechia, are little pinpoint hemorrhages under the skin. So that can come from impairment of clotting factors because of the effect on the liver and these opacities, which are cloudy spots on the cornea, which is the surface of the eye. And again, leukopenia. But a key diagnosis here is to run clotting times. So we draw what's called a PT and a PTT. And those test how long does it take the blood to clot. So if it takes longer than so many seconds, I feel like 100 seconds, I'm trying to remember what the normals are. But if the time is extended, it means it's taking that blood longer to clot. which means the animal is prone to bruising, and that's the clinical sign that we notice. So obviously, back to anorexia and the petechia, you can obviously do a blood test and isolate the virus, but the low white count, increased clotting times, and then obviously if we do necropsy, which now we're sending samples from a deceased animal, there can be liver lesions where there could be spots on the liver that look abnormal because that's what it affects. Now again, supportive care, maybe antipyrexic, IV fluids, antibiotics, but potentially a blood transfusion. If an animal has enough bruising, they could be a little anemic, but this type of transfusion, you might transfuse the clotting factors. So one type of, I talked about this in lecture, one type of transfusion is what's called FFP, fresh frozen plasma, but plasma will replenish clotting factors if need be. Now, parvo, hemorrhagic gastroenteritis, I don't want anybody to write a clinical sign that does not include, it must include vomiting and diarrhea. I mean, that's the gold clinical sign that we see, we think with parvo. It settles in the small intestine, so it attacks the intestinal lining. And then, because the intestine is inflamed, it can cause absorption of bacterial endotoxins. And an endotoxin is chemicals that bacteria release. It's like a byproduct of their metabolism. But an endotoxin, if you have enough intestinal bacteria multiplying, you're going to increase the level of endotoxins. So depending on how sick the animal is and the prevalence, could be worse. And then again, puppy mills, boarding facilities, shelters are going to be high-risk environments. I always kind of use this term in lecture. If I was playing Family Feud and someone said, the #1 breed that gets parvo, I'd hit the buzzer and I'd say Rottweilers. But Rottweilers, Dobermans do seem to have a higher tendency to get this. And the younger they are, the worse they get. I worked with a doctor, a good ER doctor, and he was pretty smart. And he felt like, and he told most clients, with parvo, it's almost like your dog has a 50-50 shot. And sometimes it didn't matter what treatment we did. I told you guys there's in-house treatment where they are hospitalized on an IV, expensive IV antibiotics, IV fluid support, repeat CBCs. They'd get a CBC almost every day so we could monitor their white count. And that is fairly expensive. If you choose the outpatient route, they would bring the animal potentially every day for sub-Q fluids and antibiotic injections. We wouldn't necessarily do the blood work as often to save them money. Every CBC is about $80. So every time you run 3 CBCs, you're at $240. And that was the price at VCA 4 years ago, so I'm sure it's probably gone up. But obviously, sudden onset of bloody diarrhea with vomiting, anorexia and lethargy, so they're depressed, dehydration because they don't want to eat, and the more liquidy the diarrhea is, the worse the dehydration is going to be. And what we really look at when we diagnose is you have a SNAP test. Obviously, clinical signs are huge, but you're usually going to do a SNAP test, and if you do a CBC, we're really looking for lymphopenia. It affects primarily the lymphocytes, but all of the white blood cells can be low. If you have an overall, and you need to know for the test, the difference between lymphopenia and leukopenia. Leukopenia means all white blood cells are low. Lymphopenia is only talking about lymphocytes. So what they're saying in parvo is it is worse if all of the white blood cells are low. That's a poorer prognosis. And treatment, like I gave you options. Most of the time we're going to probably add an antiemetic and potentially give nutrition support, but they really cannot have anything by mouth until there is no vomiting for 24 hours. And then you go slow. And I gave you guys this practical tip the other day, because when an animal has not been eating, and it's very satisfying when you give them a little meatball of like intestinal diet and they gobble it down and their little tails going and they're so happy to get some food. It is so tempting to be like, I'm going to go get you some more. But remember, we got to go real slow. If they can hold that meatball, I mean, usually we start with a little tiny bowl of water, and they can lap up some sips. And then in a half hour, you give them a little more. And then you add water. And if they keep the water down for an hour or two, usually the doctor's like, let's give them a meatball. So you just give them a little meatball, and usually bland diet. That doesn't mean a doggy biscuit. And then if they eat that, you go slow. But that's very important when you're dealing with GI, is that you can go too fast and you can start the vomiting all over again, and then you're back to square one. So, and it is killed with bleach, so it is easily killed, at least. But it can live in the environment for 6 months to a year. It's very hardy. So you have to disinfect the yard, the kennel, fomites, but it's primarily fecal-oral contact. And rabies is viral encephalomyelitis. Encephalo is brain. Myelo is the connective tissue around the brain. So everything in the brain and the nervous tissue is inflamed. This is fatal, and it is spread through a bite, which is key. But it can travel through the nervous tissue, from the peripheral nerves to the spinal cord to the brain, and can actually also infect the salivary glands. The 3 stages to know: prodromal, furious, and paralytic. Obviously, prodromal is what and there's some notes underneath here, but this is early. And what I want you to know about this for the test is this is when you see behavior changes. The nocturnal animal out during the day, or a nice dog all of a sudden turns aggressive, or they act like they forget how to do things, or you call their name and they just respond inappropriately or don't respond. And those are the kind of the early prodromal. And this is when they're at greatest risk of exposure, because this is when the animal can become very fearful and aggressive, and they have a high viral load. And then it goes to the furious, which is excited, where they start to attack things. And then it moves to the paralytic, where you start to see, and it's an ascending. The paralysis usually, or the weakness, starts in the back end. It works its way to the front. But how it becomes fatal is it can cause enough brain swelling to put pressure on the brain, but it's going to eventually paralyze the diaphragm, and they cannot breathe. So once the paralysis kind of reaches the thoracic cavity, if you paralyze the intercostal muscles and you paralyze the diaphragm, they cannot expand their lungs, and they cannot breathe. Things to know about rabies as far as, clinical signs, is typically some type of CNS disturbance, change in behavior, aggressiveness, stumbling, stuporous, all those kinds of inappropriateness, and then the hypersalivation, big change in attitude, and then they can be biting. And it can also, when we talked about it, paralysis, it can change the tone of their bark because of the nerve control to their larynx. It basically, they can't change the tone, and it can change the sound of their bark. But it's hard to diagnose. What you need to know is, unfortunately, for a definitive diagnosis, you have to cut off their head and send the brain tissue to the lab. Now, the lab needs to access the brain tissue, and we usually need to do this within 24 hours because you're just going to chill. You cannot freeze them. It has to be live brain tissue, so it has to be chilled, and you have to send the entire head, unfortunately, for a definitive diagnosis. And then we talked about if they're healthy and we know they're vaccinated, there's a 10-day quarantine. If we don't know if they're vaccinated, it can be up to 6 months depending on the state. So it is a fairly long quarantine. And then bleach inactivates it, so at least it is killed easily. Leptospirosis is a spirochete bacteria. You don't need to know the serovars. I just want you to know it's a spirochete. It is a aerobic gram-negative, so it is a bacteria. This is not a virus. It can survive in wet soil. The big thing is stagnant water, pond water, puddles, even a bird bath. I have a very small, short bird bath, but I'm sure all kinds of critters, birds get in there, but I have squirrels and things. So wild animals urinating in, these areas are how it's spread. So it's urine of rodents, and the urine seeps into the standing water, and then your dog goes and drinks from a puddle, or they step in a puddle and they lick their paws. So it can be one or the other, stepping in wet soil or stepping in puddles or swimming in a pond, drinking from a pond. And it is zoonotic. So rabies is zoonotic. And this one is zoonotic. Pond water, zoonotic. Vomiting, anorexia, but muscle pain. And eventually they can get jaundiced, and it can affect the liver and kidneys. So when it gets to end stage, they show a lot of renal signs. But think urine, kidney. So you can do antibody titers to see if there's a presence of antibodies, which tells you there's a presence of the virus. And there's going to be fluid therapy, antibiotics, antiemetics. Kennel cough, which is another bacteria, Bordetella bronchoseptica, except it's a coxobacillus. So it's kind of like it's not a circle, it's not a rod, it's kind of in between. But combined with these, it is aerosolized, obviously, through coughing, and it rarely goes beyond. So this is a huge one for fomites, because kennel doors, shared toys in a kennel, because a lot of times animals go to the boarding or they've come from a shelter and they have it. We got a lot of dogs once from Animal Humane, Animal Care and Control, and they all broke out with coughing, and a couple of them progressed to a pneumonia. So it did go beyond the normal clinical signs. But the coughing is retching, and expectoration is when they cough something up. And a lot of times it's just white, foamy, kind of thick saliva, and they kind of cough, 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 hack. There's like a hack at the end. And then they can get, they can get laryngitis where they're sore. You can elicit a cough. If it goes on long enough, they don't want to eat because their throat hurts and they're constantly coughing. And it can progress because the respiratory tissues get so irritated by all the coughing. If you start to see mucopurulent discharge, and then it progresses to a pneumonia. So it can get serious, rarely fatal, but typically the clinical signs, blood work is not super great. Cultures aren't super definitive. most of the time, this is going to be based on history and clinical signs. They were just at a boarding kennel. Now they're coughing. Sometimes you will take a radiograph. If there's mucopurulent discharge, you do want to see what the lungs look like, because if this moves to the lungs and you see changes, that's a more serious case. But, you know, 7 to 14 days is a typical course. It can stop itself, but you can do antibiotics. Also, typically antitussives are cough medicine, because again, suppressing the cough is going to make them feel better. It's not curing the illness, but the antibiotics will, you know, amoxicillin or doxy are going to be the gold standard. And then typically, you know, hopefully they'll start eating. People may have to entice them. And then there is a vaccine for it. Again, it's not a core vaccine. I talked about coronavirus. Let me get, Lyme's disease is not on this one since we already did Lyme's disease. But let me pull up, oops, not that. That's not what I want to do. Let me pull up our, okay, come over here, notes. Okay. Okay. Are there any questions about the canine ones? I know I was trying not to spend, I'm trying to split the time, but it's not going to be equal. But again, I know a lot of you said this was review, so that's good. Feline upper respiratory disease, which is primarily caused by the herpes virus, calicivirus. I wrote rhinotracheitis. I did not write viral there, and I meant to, that should be on the notes. But the viral rhinotracheitis is actually caused by a herpes virus, or this is the calicivirus. But again, this is going to be in crowded facilities, boarding kennels, shelters. As far as, you know, clinical signs, obviously not eating, but the key here is sneezing and coughing, ocular nasal discharge. Now, what you can see sometimes with calicivirus, which we get concerned about, is if it moves to the oral ulcers or the interdigital ulcers, because it can cause, they might be limping, slightly lame because their feet hurt. I've been guilty of this too. I've seen animals limping, and probably because I was a surgery tech, I think limping. Don't ever neglect looking at the bottom of the paws, because if they have anything wrong with their paws, they're going to limp. So if we see sores in the lips, the tongue area, but basically it can be self-limiting, and treatment for these guys is especially supportive care. They're going to need IV fluids, antibiotics, potentially, we don't really use cough suppressants in these guys, but you want to keep their eyes and their nose clear, because remember I said when a cat, when they want to eat, they have to be able to smell their food. So the issue with these guys is sometimes they're so stuffy that if they can't smell, they don't want to eat. So sometimes just cleaning their nose, wiping their eyes, making sure their food is very aromatic will help. It is part of the core vaccines, but again, I'm not stressing that. And then there is kind of our kitty parvo, which was the panleukopenia. And if, again, I love breaking down words. Pan is all over, leuc is white, and penia is low. So leukopenia causes all the white blood cells to be low, but it's very contagious, and it is linked to canine parvo. So you can use a canine parvo test to detect panleukopenia. So even if it says dog, You still put the Q-tip in the kitty rectum, kind of swab it around. It should show up positive. This is another one that's been almost completely eradicated with vaccines. So it's not super common, but it can have a higher mortality in the younger kittens. If they're a little bit older, their body has more stores, they can fight it off. But in the young ones, it can make them, I mean, it causes such a severe vomiting and diarrhea, and then they get dehydrated, and then they're not eating, and then their white blood cells are low, and secondary infections, and it just sets up an awful cascade of events. And again, if their white blood cells are below that 2,000, which is pretty low, then they have a poor prognosis. Again, treatment is like IV fluids, antibiotics, antiemetics. It's more of your supportive care. Try to support the body while it fights. And again, when you do the vaccine, it's almost eradicated. So most are going to be okay. And does anyone have any questions? If I'm going too fast, I'm sorry. I know we've only got like 3 minutes. I can do this. But remember, FIP is infectious peritonitis. Again, this is not a core, typically in the core group, but it does come up from a coronavirus. And it is shed in, you've got tears, urine, saliva, feces. And so the problem is it can have a fairly high mortality. I do want you to know, I didn't write it on this homework, but remember there's two. There's the wet or effusive, which means peritoneal effusion or fluid. Every FIP cat I've remembered in my head that I've ever seen has this giant belly full of fluid by the time it progresses, and that is the wet form. And the other thing is it can cause difficulty breathing. It can affect the thorax. They can get fluid in the thorax, but it's typically this abdominal effusion. There's a lot of lab testing, it can affect the liver and the kidneys as far as causing inflammation to those organs. And then, but abdominocentesis. And what you're looking for is the specific gravity, the protein content. Remember, fluid in the abdomen or the thorax should be very watery, very serous. It's really only a lubricating fluid. We shouldn't find protein. We shouldn't find cells. We shouldn't find debris. So when you find any of those in an abdominal sample, that's indicating that something is in that fluid and that's abnormal. The dry form is not as common, but it's very grave. You try the supportive care. You can pull the fluid. You can do it. Now, an abdominocentesis is puncturing the abdomen to remove. It can be removing just enough for a sample, or one of the treatment options is to pull all the fluid off and relieve you're not going to cure them, but by removing that fluid, they can breathe, there's less pressure on their organs, they can feel a lot better, and they can be vaccinated for it. And the big thing with FIV is fighting its infectious or immunodeficiency virus, highly contagious, but male unneutered cats are its predominant, spread by fighting. And again, think of it this way, I keep saying infectious, immunodeficiency virus. In this situation, when their immune system isn't functioning properly, they're just prone to all kinds of things. It can be skin infections, it can be ear infections, it can be ocular disease, it can be anemic, it's like upper respiratory infections. They're just prone to everything, and it may be you know, initially there's not a whole lot of clinical signs, and then it can progress to just these infections. Okay, and I didn't get to feline leukemia, but do you have any questions? So probably what I will do, actually,